channel of mine. Thank you so much for passing by this channel today. So if you are this is actually your first time seeing my video. Oh God, you're missing a lot. Why don't you click on that subscribe button to get more of our health tips, more of our vlogs and relationship talks. It is going to be an adventure for you and I. So thank you so much. I will be giving you a second to do that. So I think the second has passed. So subscribe. Thank you so much for subscribing. And also don't forget to click on that notification bell to be notified whenever I upload a new video. So let's get down to the topic of today. So what are we talking about today? It's not something that you don't know about. It is ulcer. Ulcer. Many people I know today suffer from ulcer. I don't know why, but you're going to know why today. I will be telling you why. Okay, so don't go to look for the why. The why is really here in this video. So guys, we are going to be talking about ulcer. We're going to be talking about the types. We're going to be talking about the causes. We're going to be talking about the diagnosis and the treatment of ulcer. So stay tuned. Go and get your popcorn, go and get your juice, and sit tight and watch this video. So now, what is ulcer? You know, most of us say ulcer without actually knowing what ulcer is all about. Okay, ulcer is a sore that is found in the lining of the digestive system, in the protective lining of the digestive system. Okay, so when this happens, that's when you feel pain in your stomach, that's when you feel pain in different parts of your body. I'm telling you today, and I'm sure of what I'm saying, that so many people suffer from ulcer without actually knowing what is wrong with them. Yes, they don't know what is wrong with them. So maybe after listening to this video today, you will be able to know or have a little bit knowledge about what ulcer is, and you go to your doctor and get diagnosed and know what exactly is wrong with you. So many people treat so many things that may not be ulcer. You might be treating infection, you might be deworming without actually knowing that those things are not what is happening to you, that you are suffering from the symptoms and signs of ulcer. Okay, so we are going to be talking about the types of ulcer now. So we have types of ulcer. Having talked about what ulcer is, we have types of ulcer. The major type of ulcer is a peptic ulcer. We have peptic ulcer, and this peptic ulcer is caused by a pepsin that is released in the digestive system. It's more like an acid that it is released in the digestive system, whereby causing all this pain and obstructions in the digestion. So this is what a pepsin does to you, it is called a peptic ulcer. So this peptic ulcer is divided into many parts of your body. It is divided into, like, there are some parts of your body whereby if the place is having a sore or paining you, you will be able to know the type of ulcer you're suffering from. So I'm about to demarcate the types of ulcer right now. I'm about to differentiate and demarcate them. Okay, so the digestive system is divided into parts. You know, this also happens in the digestive system. It happens in the protective lining of the digestive system. So the digestive system is divided into many parts. Okay, now we have the mouth, we have the esophagus, we have the duodenum, and we have the stomach and the intestine. So these is all parts. They are all parts of the digestive system. So once you have the peptic ulcer present in your stomach, it has a name. It is called the gastric ulcer. So once it's present in the stomach, it is called the gastric ulcer. Once it's present in the esophagus, it is called the esophageal ulcer. And once it's present in the duodenum, it is called the duodenum ulcer. So these are the places, types. They are being differentiated so that you go to the hospital and get diagnosed, so that they will know the type of ulcer you're suffering from, whether it is a gastric ulcer which happens in the stomach, or whether it is an esophageal ulcer which happens in the esophagus, or the duodenum ulcer that happens in duodenum. So guys, those are the types of ulcer. We also have lesser types of ulcer, which are the stress ulcer that you acquire from stress. Okay, so from stress people can acquire some sort of ulcer. Okay, so we also have the ulcer that causes bleeding. So when the peptic ulcer has lasted for a long time in your body, it causes your body to start bleeding. And once you notice this bleeding, this ulcer is now out of hand, is the most dangerous part of ulcer. All you have to do is to go to the hospital and get treated immediately. If not treated, it can get worse. So having said these types of ulcer, I would love to mention the causes of ulcer. What causes ulcer? I know people might be eager to know what causes this ulcer. What is this? What is actually causing this ulcer? Just like I mentioned before in the beginning of this video, there is an acid released in your stomach that tends to destroy the tissues in the digestive system, and when this is released, it runs out the tissue in the digestive system. So this is number one cause of ulcer. We also have a bacteria called the H. pylori. It also causes ulcer, the H. pylori. Then other causes of ulcer include smoking. When you smoke, stomach cancer, these things can cause ulcer. Also taking inflammatory drugs, anti-inflammatory drugs like ibuprofen, aspirins. These are all the causes of ulcer. So these are the causes of ulcer. We also have symptoms of ulcer. I hope I'm not being too fast, so that we can be able to get and understand these things. Okay, so the symptoms of ulcer are the things that will happen to you, that you will be able to say, okay, this is ulcer, these are the symptoms of ulcer, I need to see my doctor. Because so many people are having this pain in different parts of their body without actually knowing what it is. So we have the abdominal pain. So this abdominal pain is a symptom of ulcer. We have nausea and vomiting. There are symptoms of ulcer. Heartburn, loss of appetite, sleeplessness. There are causes of ulcer. The symptoms: sleeplessness, when you are always tired, and pain in the stomach. It is a cause of ulcer. When also your stomach, your lower abdomen is looking all free, that you're not feeling it, it's also a cause of ulcer. So these are the causes of ulcer. Now, the diagnosis. How can you be diagnosed? Simple. You have to go to a physician. Once you go to a physician, the person will ask you where exactly you're feeling the pain. Just like I've said right from the beginning of this video, that there are so many types of ulcer, and it happens in different parts of the digestive system. So when you are being diagnosed, the doctor is going to ask you many questions that will now determine which type of ulcer you're suffering from. You are also going to be running some tests. Okay, after running the test, he or she will be able to know the type of ulcer that is disturbing you. And when they have known this type of ulcer that is disturbing you, that's when you are going to be diagnosed. Okay, that's when you are going to be diagnosed. So we also have the treatment. Part of the treatment of ulcer is that you have to avoid taking anti-inflammatory drugs like ibuprofen and aspirins, so that once you stop taking them, those things that conquers the ulcer, you will be able to feel normal again. And also you're going to be given some drugs. There are some drugs that when you take it, the pains will calm down. Drugs like Gestid, once you take it, the pain or that you're feeling or the heartburn that you're feeling will be able to calm down. So we have things also that you have to avoid for ulcer to be managed. We manage it too. There are things that you have to avoid for this ulcer to be managed. Okay, the things like smoking. You have to also avoid taking of alcohols. You don't have to take alcohol. Yes, avoid it as much as you can. Then also caffeine, soft drinks, you have to avoid taking them. Also avoid taking anti-inflammatory drugs. Avoid taking anti-inflammatory drugs. So all these are the things you have to avoid in order for you to be able to manage your ulcer properly. And also you have to visit a physician for you to be able to feel whole again. So there might be other things you have to avoid. Avoid taking spicy food. Avoid taking spicy food. Okay, just avoid taking spicy food because it has a high tendency of increasing your pain. Then also, let me come down to a Nigeria. You have to stop eating more gari and eat more of smooth foods like semovita, or if you love fufu, you also can take it because it will be able to ease the pain. Okay, so all these things are what you have to do in order to manage your ulcer. So having talked about ulcer, I also advise you to see your doctor. Make sure you see a physician so that you'll be diagnosed, because ulcer, when not handled properly, can lead to bleeding ulcer. So thank you so much for watching my video. I'm so happy that you are able to watch this video till the end. So guys, if you have watched this video to this time and you have not clicked the subscribe button, please try to click the subscribe button so you will be able to see my videos when I upload them, and also click on the notification bell so that you'll be able to be notified whenever I upload a new video. So it's a girl, Jean Thomas, and I am a health educator, and I have talked about this ulcer. If you love my content, please give me a thumbs up, share and like my video. Thank you so much.